Energy source for semen. Option A fructose, option B LDHL4, option C citric acid, option D transferrin. And the answer is option A fructose. Normal glucose value in CSF. Option A 15 to 45 mg per dl, option B 0.5 to 1.2 mg per dl, option C 70 to 110 mg per dl, option D 40 to 80 mg per dl. And the answer is option D 40 to 80 mg per dl. High values of CSF protein are detected in option A bacterial infection, option B viral infection, option C fungal infection, option D both A and B. And the answer is option D both A and B. Low value of CSF glucose are detected in option A bacterial infection, option B fungal infection, option C purulent meningitis, option D all of the above. And the answer is option D all of the above. The most common specimen used for the diagnosis of intestinal parasitic infection. Option A urine, option B blood, option C sputum, option D none of the above. And the answer is option D none of the above. Grease test is used for option A nitrite, option B occult blood, option C urobilinogen, option D bilirubin. And the answer is option A nitrite. Benedict's test giving yellow and orange precipitate indicates option A sugar absent, option B 2+, option C 3+, option D 4+. And the answer is option C 3+. Contaminated urine with bacteria may give pungent smell due to the formation of option A urea, option B uric acid, option C ammonia, option D nitrogen. And the answer is option C ammonia. Normal CSF pressure measured at lumbar puncture. Option A 120 per 80 mm Hg, option B 70 to 150 mm of water, option C 60 to 90 mm of Hg, option D 100 to 180 mm of water. And the answer is option D 100 to 180 mm of water. The counting chamber of choice for CSF cell count is option A Levy's counting chamber, option B Fuchs-Rosenthal counting chamber, option C improved Newbar counting chamber, option D Barker counting chamber. And the answer is option B Fuchs-Rosenthal counting chamber. TB meningitis can be suspected by the presence of option A xanthochromia, option B cobweb clot, option C turbidity, option D coagulum. And the answer is option B cobweb clot. In xanthochromia, CSF color will become option A red, option B yellow, option C green, option D gray. And the answer is option B yellow. Predominant cells found in CSF differential count is option A neutrophil, option B basophil, option C eosinophil, option D lymphocytes. And the answer is option D lymphocytes. Normal pH of CSF is option A 6.7 to 6.9, option B 7.9 to 8.1, option C 7.3 to 7.4, option D 4.8 to 5. And the answer is option C 7.3 to 7.4. CSF glucose is lowered in conditions except option A bacterial infection, option B viral infection, option C fungal infection, and option D TB meningitis. And the answer is option B viral infection.